Every woman experiences some degree of diastasis recti, which is the separation of your abs as a result of pregnancy. You can't avoid it, but what you can do is significantly improve how well and how quickly your diastasis recti heals. One of the best and most important ways to do that is to take care of your abdominal muscles in the first 8 weeks after giving birth. That's when most of the healing occurs, which means it's the most important time to avoid common mistakes that delay your healing and weaken your abdominal muscles. In this video, I'll walk you through what the common mistakes are and how to avoid them to ensure that you give your abdominals the best chance to heal during this crucial time. These mistakes can enlarge the gap between your abdominal muscles, requiring more intensive strength training later on and also increasing the risk of back and pelvic pain postpartum. But don't worry, I will also give you some tips on building a strong core postpartum. Let's start with how you get into and out of bed. The traditional way uses a crunch-like maneuver, which creates a lot of pressure within the abdomen. To control this pressure, the core needs to be strong and work in a coordinated fashion, which just isn't possible in the first 8 weeks after giving birth. Putting repeated pressure like this on your abdominals can exacerbate or even contribute to complications such as hernias and pelvic dysfunction symptoms like pain or incontinence. You can avoid this by using a technique called the log roll. When getting out of bed, start by laying flat on your back, then bend one knee at a time and keep them glued together as you roll onto your side. Start to exhale out through the mouth as you swing your legs off the bed. Use them like a pendulum while pushing yourself up with your elbow, keeping your shoulders and hips aligned. To reverse this when getting back into bed, start by sitting on the edge of the bed, then exhale as you lower your body sideways while lifting your legs up together. Adding an exhale breath during the log roll helps to activate your deep core muscles, which help control pressure in the abdomen. This helps prevent the abdominal contents from bulging out through the abdominal wall. Mistake number 2 is incorrect breathing. Exhaling during the effort part of a log roll is a good example of how breathing correctly can activate your deep core system and strengthen your core. However, learning to breathe postpartum can be really challenging as the diaphragm has just spent 9 months pushed up into the rib cage so the baby could grow. This makes the diaphragm a bit lazy, so when women are told to do diaphragmatic breathing post-birth, a lot of the focus is on the belly just bulging and contracting. This puts a lot of stretch through the connective tissue, delaying the healing. The correct breathing technique is 360-degree breathing, which focuses more on the coordination between the diaphragm, the abdominals, and the pelvic floor muscles. This creates tension and strength in the connective tissue, helping it heal. In addition to 360-degree breathing, there are other things that are going to help with your recovery. At the same time, you also want to make sure that you don't do things that will hinder your progress. There are several common daily activities and movements which you need to tweak slightly to ensure optimal recovery. I've put together a free guide with all the details on what these movements are and how to avoid them. You'll find a link to that down in the description if you'd like to grab a copy. Alright, now back to how to do 360-degree breathing. Make your way down onto your back with your knees bent and feet flat on the floor. Place your hands on the side of your rib cage. Inhale in through the nose as you feel your rib cage expand at the front, back and sides. Then exhale out through the mouth, making a sound. Let's do that one more time. Inhale into the rib cage and then exhale out through the mouth. Now place one hand on the lower abdomen below your belly button. Take an inhale breath and I want you to still focus on breathing into the ribs, but what you will also feel is a subtle rise in the belly, but the connective tissue isn't stretching or bulging outwards. As you exhale, feel your 2 hip bones draw together as you zipper up from the pubic bone to the rib cage. Now the corset muscle of your core, which is the transverse abdominis, is pulling sideways on the linea alba, helping to create tension and strength, encouraging the abdominals to heal. Mistake number 3 is poor posture. Poor posture when standing, sitting, or lifting is another mistake that results in excess uncontrolled pressure within the abdomen. This again leads to stretching and weakening of the connective tissue. While standing, if the pelvis is rotated backwards, which is commonly adopted while holding a baby, you can see how the abdomen protrudes outward due to the increase in pressure. But you also don't want to rotate the pelvis too far forward. If the pelvis is rotated forward, the abdominal muscles become stretched, also putting more pressure and load through the abdominal wall. Ideally, you should adopt a more neutral pelvic position. This reduces pressure within the abdomen so the linea alba is not being stretched and the core can work in a coordinated fashion. To find a neutral pelvic position in standing, rock the pelvis backwards and forwards and then stop in the middle of those two extreme movements. Make sure your ribs are stacked over your hips and you're tall through the crown of the head. When it comes to sitting posture, the pelvis also tends to rotate backwards. This leads to a slump posture where the abdomen bulges out, stretching the linea alba. To avoid this, try to use a nursing pillow wherever possible. You should also avoid sitting in chairs that are too deep or that lack lumbar support. To find a neutral pelvic position while sitting, again, rock the pelvis backwards and forwards and feel those two extreme movements and stop in the middle. If you're still having trouble, try moving your bottom cheeks out to the side. This will help you sit right on top of your sit bones. In this position, the abdomen is not bulging outwards and the linea alba is not on stretch. The next mistake is poor posture when lifting a baby off the floor. When picking their baby up, many women bend forward from the upper back with their legs straight. This creates a significant amount of pressure on the abdominal wall, once again stretching the connective tissue and weakening it. To lift your baby safely, adopt a staggered stand position where you have one foot in front of the other. As you lift, keep the child as close to your body and remember to exhale as you stand up tall. To lower your baby, maintain the staggered stance position, keep them close to your body and exhale as you lower down. Mistake number 4 is wearing abdominal compression garments which are not medically graded. This can lead to too much compression, which increases pressure within the abdomen, putting more load through the abdominals and the pelvic floor. This can make diastasis recti more severe or exacerbate pelvic dysfunction issues such as urinary incontinence or pelvic organ prolapse down the track. Below, I've included a link to SRC Health and Baby Belly Pelvic Support, which are 2 brands that I recommend for postnatal compression leggings, shorts, and belts. Mistake number 5 is straining and bearing down to poop. This straining not only stretches and weakens your pelvic floor muscles, but also creates excessive pressure within the abdomen. When repeated over and over, the pressure makes the diastasis recti weak and more severe. So the best thing you can do is invest in a squatty potty. So basically this straightens out your anus so the poop has a more direct route out. Avoiding these mistakes is the first step in making sure you give your body the best chance to heal your diastasis recti after giving birth. You should also be focused on actively strengthening your core safely and gently to give you the best long-term outcomes. Watch this video next to learn how to activate your deep core system and safely strengthen your core during this crucial postpartum period. Rebuilding that strength through your core and pelvic floor will help reduce likelihood of you experiencing chronic back pain, pelvic pain, incontinence, pelvic organ prolapse, hemorrhoids, hernias, constipation. These conditions involve a long rehab time, so prevention is better than a cure.